Very impressive, Romy. I'm not sure what to say. And I have to digest some of the things you're saying, so I cannot come up with an immediate question. I'm not sure whether you or whether somebody from the audience or
maybe later.
Yeah?
Maybe later.
What's the question?
Yes.
Yeah.
You mentioned at one point that the sort of AIDS activism support groups are dying out, and obviously when you look at the history of AIDS activism, like the US-based groups like TAG or Gay Men's Health Crisis, I really envy their sort of militant activism. Like in Latvia, we have a big issue right now that about 1,500 people receiving HIV medication, and really good one, because we do have good medication in Latvia for those who have access to it. However, out of those 1,500, there are only about 20, and I'm not exaggerating, 20 activists, plus about 8 of them are HIV positive and 12 of them are HIV negative. So, and it really angers me because, 1,500 people are receiving free medication and none of them wants to get involved. And very often I say to these people, it's very unfair. You're getting something for free, you're not helping your fellow patients. I'm curious, how do you tackle that issue in Switzerland? Why, first of all, in summation, why there's such low AIDS activism nowadays, and how do you involve the people? Because for us, like in Latvia, it's a big issue to get people on the board. Because NGOs, as you know, and also social support groups have actually a big role in shaping governmental policies in HIV, and I've seen success stories on the ground for that.
Well, thank you for your question, and I don't have a recipe, to be honest. We have 15,000 people living with HIV in Switzerland, and maybe 20 activists. So we're not doing better than Lativa. So I remember that in the support group that I created in the 90s, I would come back from an international AIDS conference and try to share, because we were told you have to share information with people living with HIV. So I would talk about what I learned, and nobody was interested. So I don't know. I just know that I don't allow myself to be stopped about an inaction of people, and maybe there's just for people there's a time to be active and a time not to be active. So I know some activist friends, for some time they've retired themselves and now they come back in. So I don't know, I have no recipe, to be honest.
Okay, so I think Romy will get back on the podium.
I just want thank the speaker. But what I'm trying to say is doctor-patient relationship is the key way. And when I was talking to Professor Ray in Durban in South Africa just a few weeks ago, or months, just a few weeks, he said, doctor-patient, we need to work together as a team. That's why I came here, to see how we can engage together. And I see a lot of clinicians losing, not engaging into HIV. They move on other disease areas. But if you motivate, if you talk to patients, I think you can. You can get better. You can work together. I think that's what I'm trying to say. That's it.
Thank you, Elijah.
Doctor-patient relationship. Doctor-patient is the key point.
Yeah, thank you, Elijah. And I've experienced the same. One of the clients I work with, I went with her to see the doctor, and before we made a list of the topics she wanted to ask. But when she was sitting in front of the doctor, she became so small, She was so afraid to ask questions. And I told her, I'm not there to talk for you. You will talk yourself. So I was just there to encourage her to ask the questions that she wanted to ask and she had written down. So I agree with you. A lot of people are afraid of a doctor out of whatever reason. It's just a fact, and we have to help them to overcome that fear.
Okay, thank you.